My name is Paolo Prado. I'm from the Cardiovascular Institute of the Medical City. Well, that's a challenge now that there's a pandemic. Before I used to swim in the condo pool. I used to do laps in the pool, but now that there's a pandemic, we're kind of restricted with the kind of exercise regimens that we can do. But I usually just go on biking most days of the week. I have a bike that I go on every other day at least, and I go for like 1 to 1.5 hours of biking around the Pasig area. I don't have any other comorbids except for asthma, so I have a very varied diet. I try to eat more vegetables and fish, but I do indulge in a steak every now and then. I try to watch my LDL because we have familial dyslipidemia, and so far my numbers are good. And I balance indulgence with eating healthy, because if you eat healthy more, then you can indulge more. I engage in moderate drinking, so it's fun to drink. But I try to moderate it to about 1 to 2 drinks per day. I try to avoid binge drinking because we know that that's bad and it does stuff to the liver. But we kind of try to balance everything out. We try to have fun with a little amount of alcohol every now and then. But I don't smoke. We all know that that's bad, and we try to stay away from tobacco. Earlier on, I tried to maintain an ideal body weight, but I've achieved that so far the last year. And now I'm trying to maintain my muscle mass. So as you know, when we start aging, we kind of lose a lot of muscle every year after 45. And I'm getting a little bit older now, and so I started to lift weights in an effort to keep my muscle mass adequate. As an inspiration, I have a patient who's about 75, and his muscle mass is better than mine. He's a bodybuilder, and at 75 he's able to move as quick as a 40-year-old. So, and I would try to emulate that in a patient. And as a doctor, we should be at least try to maintain our own health the best way we can. Well, the basic stuff would be to eat healthy, eat more vegetables and fruits, less fatty meat, avoid alcohol, too much alcohol, don't smoke, and be physically fit in whatever way you can. So, given the situation, but I'm sure the environment will be better for exercise in the coming years.